Hello and welcome to the Chris Will Podcast on iCode Media. Today I wanted to provide you with a flashback from almost a year ago, a little bit longer than a year ago, when we were talking about COVID and some of the predictions we were making, as well as some of the things we were living through. And I thought it was really refreshing to go back and listen to that, because sometimes it's hard to put yourself back in the perspective that you once had. So this was from March, like late March, March 26th, this conversation. So please enjoy. And as always, be sure to subscribe to the podcast, write a review, and share it with your friends. As optometrists, we're problem solvers. I always take the time to ask specific questions of my patients to ensure they don't have symptoms that they're not associating with their eyes or perhaps think is not something I can or will address. I found that asking the right questions to get the bottom of their needs is important. Questions like, how do your contact lenses feel at the end of a long day? What time of day do you take your lenses out? What time of day do you wish you could take your lenses out? On a scale of 1 to 10, how would you rate your contacts? Questions like these allow us to solve problems for our patients that they may not know how to tell us about, resulting in happier patients and more demonstrable value for our services. It also keeps our practice at the forefront of a patient's mind with new technology, and they hear about that technology first from us, which is what I think they expect. Check out the show links for how CooperVision is helping us be proactive with these types of conversations.
You know, one of the reasons that I wanted you guys to come on today was because I see a lot of this is I know people have said this is just insane what's going on right now. And I know we've all discussed this before, but I'm seeing people who on these chat groups and email chains who have these really wildly successful practices that are laying people off. I mean, they go from 1 week being totally normal. Even then they go through a week of kind of ramping down, following CDC recommendations. Not even necessarily a week. Really, we got those recommendations, I believe, on Tuesday or Wednesday.
Yeah. Yep. It was Tuesday night, right before the AOA
Tuesday
conference.
Night. And then now all of a sudden they're laying people off en masse. I mean, it's just like, it's this stuff that I've just never seen before, and I just can't wrap my mind around it. So I'll just open it up there and leave it, see what you guys want to talk about.
Yeah, I think it has been crazy, because Thursday you start seeing people say, okay, we're going to follow CDC guidelines. We're going to cut back. It's going to be emergency care. And then Friday, the same person's like, we're laying everybody off on Monday. And yeah. I think it comes down to people. I mean, I don't know if you guys have experienced this with your staff, but when we started talking about this, we had staff members that were like, hey, we understand what's going on. We want there to be a clinic to come back to work at when we get done, when this all changes. So, we trust you. That's why we like working here. Just let us know, keep us posted. And my best guess is that they've had some of those same conversations, and they're moving into a mode of, okay, we got to protect the business so that the business is here and ready to go when we get out the other side of it. And we're going to take it from that manner instead of kind of the slow cut back and see, where we're at. That's my best interpretation of what's happening.
I hope it's that. But what I'm seeing is, it seems like it's more drastic than that at times. When you go from, like Chris said, one day where it's business as usual, the next day maybe a little bit of slowdown, the next day, like I saw one example, 9 staff members just done, in and out, or associate doctors as well being completely cut. So, I mean, I hope it's that mindset of, okay, we're just going to do this collectively, and this is a group decision, not a just come in and, sorry guys, we're panicking, because it seems like such a rash decision. It seems way too knee-jerk to me.
Yeah, I don't know if it's total. I guess to clarify, I don't know that it's totally a group decision. Outside of the owner has been having conversations and has somehow gotten themselves comfortable with the idea that people are understanding and and then making the rash decision. I agree. I don't think it necessarily is a group decision that's taking place for sure.
Well, I think some people are just doing it out of panic and stress. And I think they're also seeing it as an option that's being suggested. If they're reading through online discussion forums or threads, or they're seeing kind of articles come through that say, I've seen it. I've seen five or six different articles that say, okay, here's what you need to do to survive financially. And one of the steps listed is lay off your staff so they can get unemployment. I think there's a lot of problems with that, though. And
I agree with you. I can't fault anybody, Cheryl, for doing that, because you never know what specific situation they're in.
Oh, absolutely.
And their business philosophy. A lot of people have been advised to take massive loans, and everything is about cash flow. Everything is about, but so I can't fault them for any of that kind of stuff. But it just seems. So because of that, I think you talked about fear, and you talked about, and I want to kind of get into some of that, because as I take a step back and watch some of these, the blog posts, and, the first thing I think is, and many of you have heard me talk about this, I'm sure, but it's this idea that, like, we're all headed in the same direction. We're first of all, just as any consumer is, we're at a disadvantage because we are not experts in infectious disease. And because of that, we have to trust people who we've never met, who in general, by the way, as I thought about this today, in general, I would have to go back and look at studies. But if I were to ask you, do you trust government? You would probably say, I trust my local government pretty well. I trust my state government pretty well. I trust my national government not so much, right? And yet we're sitting here with our state governments following what the national government is doing, and our local governments following what the state government is doing.
I think it depends on what you're talking about, though. I don't trust our local government to have any kind of handle on epidemiology or disease. The CDC, and that's what I think there's a fault in this idea of, like, government. There are certain things that government does have a purpose for, and one of those sure as heck better be epidemiology, disease, those kind of things. Because my city isn't going to know anything about that. My state is going to.
Correct. And I'm not making a point that we would trust our cities or our states to know those things. My global point is that we tend, as a culture, we tend not to trust the federal government very well. If you look at, like, and this isn't a trust question, but if you look at the approval rating of the president, the approval rating of Congress, for example, it is consistently, 40s is best, is high right now. 30s and 20s is what I've seen in the past. So I guess my point is, I'm not saying we don't trust the CDC. It's just like all of a sudden people are making these decisions where we have a disease that we've known about for 3 months. I can read opinions about multiple different infectious disease experts that think multiple different things.
Yeah.
And we have literally taken and again, I want to talk about this, and I'll say this clearly, is that I am not following CDC recommendations, which we'll talk about. I'm not advocating for that. I'm also not saying that we shouldn't trust the CDC, or I'm some conspiracy theorist. And I'm not saying that, that the economy is more important than people. If you know me, you know that one person, my belief is that one person is infinitely more important than like all the beautiful, cute puppies in the world, right? Like infinitely more important. But what I'm trying to wrap my mind around is this idea that we have already lopped off 30% of our economy for a disease that we don't know a ton about. And some part of me thinks it's because we don't know a ton about, like, I'm not grasping it. So like Drew, you've read some studies. Cheryl, I know you've read some studies.
Yeah.
Yeah.
What's going on?
So first of all, I would just like to comment on, you talk about trust of the government. Think about the general public and where does their trust lie? I think that they're looking towards healthcare providers and what our opinions are. And so I do think it's really important for the healthcare community in general, whether it is optometry or chiropractic care or dentistry or fill in the blank. I think it's really important for the healthcare community in general to show that we are taking this seriously, because a lot of them are trying to figure things out, trying to follow the lead of somebody. And who are they going to believe? They're going to believe a doctor that they have a relationship with, that they already trust their opinion of. So that I just kind of want to throw that out there, kind of going back to what you were just talking about. But with regards to current studies, so I think I probably, I know through my discussions with you, Chris, that I've been thinking about this longer than you have. Before the call, I actually just went back on my Amazon order history to kind of track my thought process. And I think it was when the AOA First Look email came through that first reported conjunctivitis in patients with coronavirus. And I looked back at that was February 6th, or maybe February 5th, something like that. It was February 6th when I first ordered extra gloves and put up extra sanitization units in my office. So, I've been watching this really closely since that time period. For those of you who know my husband, Tom, he works in business, and one of the things that he does is he measures a lot of metrics throughout different cities and stats. And so I just have conversations with him all the time about the stats. And to me, it's been quite obvious that if the whole nation didn't take really great measures, that we were going to look just like China. And then it goes to Europe, and you see what's happening in Europe. If we don't take measures, we're going to look just like Europe. And so I'm super frustrated that so many people here in the United States are still acting like this is no big deal. It really breaks my heart when I see all these kids on the beaches in Florida not taking this seriously. And that's why this is going to be such a big problem here. That's why we're going to look like Italy and not like South Korea. I watched the numbers. I've looked at the numbers that are being reported at lunchtime. United States, as of lunchtime today, was at 22,000 cases. A couple hours later, I looked at it right before this call. We're at 24,000 cases. And that's just what's being tested. There's not a lot of testing.
I saw, Cheryl, I want you to comment. Did you see that? I saw a little blurb come up on I didn't get a chance to dig into it deeper, but I saw that in our state, they're allowing it to be a clinical diagnosis now.
Yeah, I just read that today as well.
So that to me seems like a really big challenge, because let's say, so I'm not saying it's not good. I saw that that reaction, Cheryl.
No, I'm just looking at my phone.
I'm not saying it's not good. It just confounds the issue. Like, we now have this disease that is so bad that nobody can get it, except that we don't really know what its mortality rate. And I'm not saying that we do know, but what's going to happen when we now have the ability to make a clinical diagnosis as opposed to a laboratory diagnosis? We're going to see that ramp up. And then we're also going to see that, like, if I test Kyle and I test Drew with the test, and then you and I just get a clinical diagnosis, then we go into quarantine for 14 days. We all four come out, and I think, oh, great, I'm fine. I got herd immunity. Now I can provide herd immunity, and everything's great. My family's going to be protected. But how do I know I actually had it?
Right.
You can't know.
Don't.
Well, that's part of the huge problem, for sure. And that's when you go back and look, like the other countries that Cheryl's referencing, and you look at a country like South Korea that has their first diagnosis the same day that the United States has their first diagnosis, and they immediately jump into testing. What was it? I don't remember the exact number, but I mean, they were doing thousands of tests a day.
They were doing 20,000 tests a day
to get an idea of what was being impacted from the start.
Mm-hmm.
And have been talking about with people too, like you just said, we don't know what the mortality rate is because we have no idea how many people here actually are, and I'm taking it serious. This isn't to say not to take it seriously, but we don't know if that top number is that there's already 70,000 people that have been that have it, or 100,000 people, because we aren't testing and getting data that gives us strong information.
Well, Drew, your mortality rate is going to be closely linked to the availability of healthcare. So if you look at the numbers, I'm looking at them right now. In Italy, they have 10,000 closed cases which have had an outcome. Mm-hmm. Their numbers right now, 56% of those have recovered, 44% resulted in death. Now, alternately, if we go to, I've got the numbers right here, if we go to South Korea, their current numbers, they've had 2,700 cases that have had an outcome. 96% of those recovered, 4% resulted in death.
Right.
So part of that is skewed because since they did such mass testing, they've tested people who were not symptomatic. Mm-hmm. But part of that's because Italy's healthcare system is crumbling.
Right. Totally.
Well, the other part is that their culture is different. You know, we shake hands, they kiss cheeks. They're a lot older. Right? From what I've read, they're the oldest nation.
Yes, that's what I've read as well.
If I understand the statistics correctly, in Italy, a fairly significant percentage of their people fall in the 20 to 50-year-old range that are being hospitalized and needing care. And so the narrative on the elderly person is starting to change in terms of who's being impacted by this.
It is.
Certainly, yeah. Certainly, if that's the case, I think people will take it more seriously. You know, again, I think that's just the culture. You think, well, if you're 80 years old, something's going to get you. I mean, you know, unfortunately, that's.
I know. I hate it when I hear that. But when my husband and I were talking this last weekend about deciding, because I think we were, I don't know, I think I was probably the first office in Nebraska to close.
Yeah, probably.
And we were talking about, should we close? Should we not close? And Tom said to me, what if one of your kids ends up dying?
Yeah.
I have a daughter with asthma. You know, it was a hard decision, but it was an easy decision. I did not want to have any regrets.
You know, I reached out to Chris. I think was that Thursday, Chris? I texted you. Was it this Thursday, or it was Wednesday or Thursday? I said at the end of the day that I said it's starting to really bother me about taking this home. This is really starting to make me nervous in the clinic for staff, for my family, and those kind of things. And that's what really, that was the day we already were kind of in the process of starting to make the change, but that was the day we were like, the next 2 weeks we're changing this and we're going to see how this goes. So I hear what you're saying, Cheryl, completely.
That's what I agree, Drew. That's exactly what hit me too. You know, I feel like I've been slower to understand all of this. I think that's just my personality of taking information pretty slowly. But I feel like in the last 24 to 48 hours, it's been much more of that response. Like I had 2 patients just yesterday, and they were just patients that were more urgent type patients that I needed to see at my practice. But even them, you know, they needed to be seen and we needed to take care of some things for them. But there's still that thought and then that insecurity when they left. I was, you know, one of them, she's a nurse in a facility that doesn't need that there. So, you know, I thought, gosh, that would just be horrible, you know, if I had her, she did, and you know, and my wife's pregnant, and you know, all those
congratulations.
Well, thank you. Yes. Yeah, I think same here as the last 2 days, it's really hitting home, the reality of it.
I think it's really interesting when you look at the Facebook feed and you see the way the sentiment has shifted, even in just the last week. Doctors who were very gung-ho about saying things like, oh man, I'm seeing more kids than ever. These kids are out of school. Wow, we're busy. You know, young people don't get it, so it's fine to see the kids, stuff like that. And they're closed now. They're closing their doors. They're getting more nervous about it. I think one thing that's really important to say is it's not a time to lay blame on who is slower to act. It's not a time to judge people on if they weren't taking it seriously a week ago. and to just say, it's very important for optometrists and other healthcare providers in general to really, stand up for each other and be collaborative to figure out how we can best manage the situation moving forward.
Yeah, for sure.
Yeah, I wouldn't even say so much that it's that people weren't taking it seriously a week ago. I think it's more the case that people react to things differently, and I think
that's fair.
There's people that try to. Your point about the first time this was on my radar was, really on my radar. I don't know, probably 3 or 4 weeks ago, and it was still a problem of elsewhere. We didn't have much to know about it, and I saw it kind of come up. I can't say, but when it was really on my radar, maybe right before, so probably 2 weeks ago, where I started thinking, yeah, this is probably going to be a problem. Well, you've had a lot more time to process this than I have, or that anybody else has. I'm not defending myself. I'm just saying that anybody else, than most people have. You are certainly on the forefront of this within our profession.
Let me interject you there to go back to what you're saying at the beginning, where Cheryl, where you said that we need to be an example, and healthcare providers need to help spread that message. And I would extend that back to that's what you did. I was paying attention last week and the week before, but really kind of funny was then I saw your message on Odie's on Facebook randomly in a group saying I'm closing my office, and I texted Chris right at that point in time. And I texted you first, and then I texted Chris. Was like, "Did you see Cheryl's closing?" And he's like, "I'm talking to her on the phone right now." And then we got a chance to talk. And so that also leadership to help bring it to the forefront, because it's something. I was like Chris too. This could become something, but I don't know what, and kind of slower to make a decision. So
I would tell you, my husband and I would talk about this a lot here in the house. And what's had me really nervous about this virus the whole time is the incubation period.
Right.
We as a society are not used to something having such a long incubation period. And so, as we talk about it, one point that he mentioned as well is he said, everybody wants to have like one more last thing that they do before they decide to stop, and we were talking about that with spring break, because everybody's going on spring break. It's like, okay, I'm going to take that one last trip and then I'll quarantine. I'm going to do this one last shopping trip and then I'll quarantine. And it's like, you just can't pick that, because all of these infectious people are walking around for 5 days before they start having symptoms. And so you can't wait until you see a lot of it, because by the time you see a lot of it, the growth is exponential.
Yeah.
And so I guess I'm really heartened, Drew, to hear you say that that made an impact on you, because everyone's saying, well, how can I make a difference if I'm the only one closing? Well, I guess I was the only one closing on Monday, but I guess maybe I did make a little bit of a difference.
I would definitely say you did. That was well worth it. If it pushes the rest of us that can do it to make a decision. So, I thank you for that. And then, I don't know, Chris had wanted me to kind of bring up the UK study projections. It's been a few days now, so I don't remember all of the specifics of it, but have you guys had a chance to kind of read through that and just kind of see what that was talking about, kind of how this could look on a grand scale? And it is alarmist. So there's a lot of factors.
This is a pandemic, Drew. I think that it is a little alarming. I think the whole situation is alarmist.
Sure. It's alarmist from the standpoint of, I think there are some other factors, because it's running basically off of pure numbers, where
there are a lot of assumptions of diseases we already know. And
right. Or accuracy, because, again, not because it makes it any less serious. And that's what I've been telling everybody, is not that it makes it any less serious, but there could be a heck of a lot more of, I'm going to say there is a heck of a lot more of us that actually have this and are carrying it right now. And those numbers aren't being counted. So then therefore it skews how this thing looks. But, that also, as I was looking into it and kind of reading things, that also really opened my eyes up more again to at least do more digging and more studying of trying to figure out what the heck is going on and what we need to be spreading as a message.
And again, forgive me, I'm just taking, again, I'm trying to wrap again, Cheryl, I've had less time to wrap my mind around this than you have. And I've been trying to do this, and I've been trying to step back and say, okay, well, why? I mean, if we almost have this prophecy right now that that can never fail. So if the whole idea is to flatten the curve, and there's two questions you really have to ask, and two things you have to assume is, the first one is that the measures in place to self-quarantine and to social distance and all those sorts of things are going to be as effective to bring the total number of cases to a level where we have hospital beds for them.
Right.
And so, if that curve is going up and it's flat enough, we're assuming that those measures are going to be enough. But we can't know that. We can't know that we're not going to get there anyway. And we also can't know that, let's say we flatten this curve. What we have to realize, and what I don't think many people are really talking about, is that we're all going to have to get this disease. I mean, the studies show us, or the studies I've read, are something like 87%, and this is what the Drew's study on the UK was talking about, is that essentially over the next 18 months, 87% of us are going to have it, and then essentially, or have gotten it, or died from it, and then you've got your herd immunity. So what you're hoping essentially to do is that curve is flat for so long, but you can't know that you're not going to hit here, and you also can't know that if we go through these really radical quarantining, like is being advocated, like when people say shut it down, essentially what you're hoping to have is this, and then it goes down. But what happens in 2 to 4 weeks when you've shut it down? And let's assume we did it early, and let's assume that we taper that peak off, and now 2 to 4 weeks go by and we relax it, and then what's it going to do? Well, it's going to shoot back up again. And so it's going to shoot back up again. What are you going to do? You're going to tap it down, and then it's going to shoot back up again once you relax this. And so, like, where's the end of that? Like, where is the end of all of that? And how do you make it? I mean, and then the other thing in the self-fulfilling prophecy is, let's say it doesn't work, and we do all this social distancing, and everybody quarantines themselves so much, and we still don't have enough beds, right? And like we still don't have enough beds, and then what does everybody say? Well, geez, Chris, you didn't shut your office soon enough, right? Like it becomes.
I don't think the blame will all lie on you, Chris.
Okay, but the point is that, and again, again, we are following CDC guidelines. We have incorporated telehealth. I think within this next week, we're going to have the majority of our encounters will be remotely. But my point is that it is a prophecy that those people who say you got to do all these things, and then we do it and we don't see much, then they win, right? Like, I'm not saying they win or they lose, just they were right. And if it doesn't work and we don't have enough beds, then they're right. And if we do it and it works and we have enough beds and we let everybody else out, then we're back in the exact same spot. So in my mind, it's like, how long do we need to go? How long will the public actually go with these social distancing measures, laying people off, being on unemployment? How far does the market go? How far economically do we get into this? And before people are just like, look, it's not worth it anymore. I'm going out and getting a job, or I'm going to open my business. Come stop me. I mean, I don't know. My point of all of this is to say, have we actually ever stopped? Has anybody ever stopped to think about this? Like, this all goes wrong, right? This all goes wrong. We are completely wrong with our projections. If that can be the case, what happens in 3 months, 6 months, a year? What does it look like?
Okay, so there's a couple things to be thinking about here. first of all, I think it's wise to try and err on the side of caution. So we have the advantage of not being the first country to go through this. We can very easily look at the examples in front of us and see what the trends look like. So do I have an answer to what things are going to look like in China 3 months from now? No. But whatever happens there, we should be able to use that information to learn from. Okay, so that's going to be helpful for us to be able to study the case examples that run before us. Second of all, there are so many smart scientists and so many smart professionals working on vaccines right now. And I have a lot of faith that they will be able to come up with vaccines, and they will try to create some of that. You keep referring to this herd immunity. Why does herd immunity have to happen through exposure?
No, it doesn't.
Why can't it happen through a vaccination? So I think it's really important to, quote, flatten the curve. I don't think that it's wise to say, well, we're all going to get it anyway, so let's just let us all get it so we can all have herd immunity. Because that's, when I think about things like my parents are in their 70s. Does it matter to me if my parents catch this? Yeah, it matters. And I know you guys have older parents too. I strongly believe that, saving lives is of the utmost importance right now, and saving as many lives as we can until we have other ways to combat this.
Well, I guess, Cheryl, I didn't ask the question correctly, because I don't disagree with anything that you just said. What I'm saying is a thought experiment, right? Beyond because like I said, when we open this up, I have to trust the infectious disease guys. I have to trust they're very smart. I've asked myself this as well. I don't want my kids to die. I don't want my parents to die or my grandparents, right? So I'm agreeing with all of that. That's not the thought experiment I'm trying to have. The thought experiment I'm trying to have is if it's the case. So most of the projections I've seen is that it's going to be 18 months before we get a vaccine. And so in the next 18 months, let's assume that 1 year goes by and we do exactly what we're doing now. And it was, and we were able to bend the curve down, but we were only able to bend it down so far. And then we still wind up with these, you squash it and then you let it back into the community, and then you squash it and you wind up with these people that die. Or let's even assume that people don't die and we achieve what we wanted to achieve and we get 18. First question is probably, where's the end point in that? And second question is, let's say we achieve it. What is the long-term outcome? Is there a potential that the economy is so fractured that so many people for so long wind up dying, or that we can't help other people do the things we were helping them because we don't have the resources for it, because we were so intent on this one thing? So let's say that we can squash it down to a level of 4,000 people die from it in the United States. And yet in a year, we have, 1 million people dying because we don't have the resources for medications or for other, whatever the next thing is, from heart disease or diabetes or, you name it. So I guess that's what I'm trying to have the thought experiment about, is we are severely damaging our ability to care for people. So could it be the case that we're severely damaging our ability to care for the people in a year in order to get around this disease?
Well, I think there's definitely going to be repercussions that we will see unfold. I was talking to my brother about this, and he asked me if I thought it was going to be like the Great Depression all over again. And I said, even if it gets to that point economically, I don't believe it would last as long as the Great Depression did, because the world just moves faster now. And so I think whatever happens economically, we will bounce back from fast, because things now are just, always happening at lightning speed. So I have a lot of faith that, humans are very adaptable creatures. And I think there's going to be a lot of innovation and creativity that sparks from all of this change and all this uncertainty. And I think that we will see some really surprising things come out of this that allow us to persevere.
I think I agree with, the answer is nobody knows. We've never faced something like this with a time period of technology, economies built the way economies are built currently. I mean, we haven't. There, I think I saw somebody say the last time something like this was the Spanish flu. I mean, that
right.
There was, compare what was going on then versus what's going on now. So I think it's hard to say in a year what happens. I've had those same thoughts, Chris, like, geez, so we save all these people, especially after reading that UK study. I'm like, so we save all these people, and then like, what does that leave at the end of all of it? What's the difference? How do we get out of it? And I think, the only thing I can think of in my head is we're going to see some things we have never seen before in terms of how we come up with new economic ideas or new economic relief, or who knows if it's people just saying, hold on, I know we've never done this before, but this is stopping for a certain period of time and we're coming back, or whatever, tack it on to the end, we'll figure it out. But the challenge with this, I think, compared to, other downturns in business, the Great Depression was downturns in business that essentially drove that. This is not,
external.
The crazy thing about this for everybody is a lot of these small businesses, ourselves included, like, that's what I was talking to my banker about deferring loans he's a good friend of mine and we talk numbers a lot. And he's like, geez, you guys are cranking along, And then I'm like, yeah, but next week we're not, and he's like, I know, that's crazy. Like, so this is different, and it's going to take different ideas by economic leaders, by banks, because they're tied into it. Everybody is. They can't fill us with a new optometrist taking our spot in the strip mall. They can't go find a new restaurant to come into the restaurant spot that had to close down.
They can't evict you.
No, it's just their better money. Their better money is writing it out, hoping we can open back up and getting going. It's not scraping money right away and making profit, and then we're going to go find another optometrist to come into this spot. So there's no answer. It's different. It's just completely different.
I think it's really good too to maybe put a little shout out to the AOA for having optometrists included in that bill that was passed for the telemedicine.
Mm-hmm.
And I think that we need to make sure that optometrists have the resources that they need to do that, because I think that's going to be what helps different clinics ride this out a little bit longer.
For sure.
And I think too, it's going to be really interesting to see what type of telemedicine opportunities continue after this is over, and how many clinics continue to use telemedicine to help provide care to their patients.
So I think that's kind of the adaptability. Neither of you answered my question, by the way.
What was your question,
Nobody
Chris?
wants to participate in the thought experiment that I'm offering. But that's okay. We can move on.
Okay. So maybe if I say this, Chris, I do think that there will be second waves and third waves and whatever. And I think each of them will be smaller. And I think that we will know more about that from what happens in China and Europe as they go through their, second and third waves. Does that answer your question?
Well, what I'm trying to have is what's called a PreMortem. And a PreMortem says when everybody is focused on moving one direction in a boardroom or as experts, and everybody's saying it doesn't behoove me to be the naysayer in that group. It doesn't behoove anybody who is disagreeing with the main group of being in that group. So if we were on a board together, and you all have, I think you've all been on the NOA board with with me or without me, and if you can see exactly, think about the board. It moves in a direction. Once a couple people maybe speak up, then pretty soon everybody's moving in the same direction.
Yeah.
So what I'm trying to do here is I see everybody moving in this same direction. And again, I don't know enough to not move in that direction. What I'm trying to say is that's the direction we all think is the best direction. But what if it isn't the best direction? What does what does everything look like in 1 year? Not whether or not it is the right direction. I'm not saying it isn't. I'm just saying let's stop. Now, everybody tell me what went wrong in a year. Like,
Mhm.
tell me right now, in a year when we look back, what will have gone wrong with going that direction?
Oh yeah, no, I get what you're asking, because I mean, if you read the UK study, and of course, everybody, you feel like you got to give your disclaimers, because my thoughts of family members being sick, dying, those kind of things.
We all agree with that.
I'm going to keep moving in the direction that the herd's going. But if you read the study, I think the first this is a very summarized synopsis, was do nothing, treat it like the flu, except we don't have vaccinations. In the United States, we lose 4 million people in 3 months. It's run its course. Essentially, we've got somewhat of a herd immunity at that point in time. And we come out the other side of it in 3 months and figure out what's left, which, by the way, is I can't remember what the numbers were, but how many times the Civil War, how many times World War II, if people would be dying. Second option was,
and that projection though was based on some assumptions.
Oh, for sure. I mean, they're trying to use some data, assume data. Option 2 is try the self-distancing thing. So you can, in the United States alone, you can trim that in half. So we lose 2 million people. It peaks in 3 weeks, basically. And I think it was also 6 months or 3 months or something that essentially it probably infects everybody. We know what we're dealing with at the end and come out of it. So if you look at it from the whole, what you're bringing up about the economy, well, 3 to 6 months, we can figure that out and go from there. But we've lost 2 to 4 million people at that point in time in our country. And so then the third one is exactly what you're talking about. Separate, ride this wave for the next year till vaccinations come along. What's that do to our economy and being able to provide services for other people? And the question is, nobody knows. I mean, we don't. It crashes the economy as we know it. Certainly. I mean, there will have to, it'll either crush the economy. People are going to have, banks, people in charge are going to have to make unprecedented decisions of literally printing money, stringing things along, changing the concepts of how we have gone about business in our country for years. And I don't know what that looks like. That's not my world to deal with in terms of finances and international economics. But I think you're just trying to do your best to figure out what in your moral judgment allows you to keep going. And like you said, we're adaptable. So we'll have to figure it out at that point in time too.
Kyle,
yeah, it does change. Oh, go ahead, Kyle.
Yeah, I think it's a tough. Part of me wants to figure out. I have that same impulse, Chris. Is like, I really want to just know what is it going to be. How long do I have to do this? How long do I have to strategize and plan? As well as what are we really? What in the end is going to suffer more? I think that's the question. Is it going to be people or the economy, or is it going to be both? Like, is there some strategy that we have? I think this is what you're saying, Chris. Is there some strategy that we're going to follow that is actually going to allow the most people to die and the most effect on the economy? Like, that's what worries.
And what we want to follow
worries me.
Yeah. The one that the one that you want to follow is the one that's going to have the least impact on humans without the impact on the economy.
Yeah.
Yeah. And we can't know. We can't
But
know.
we can't know. And part of me, I saw Ben Sass. He had a good. He was speaking. I think it was before the bill passed, or when it was in the Senate for some of the cash that's getting plugged into the system, and he was just asking people to slow down, and I think that's really good advice. We kind of started off the conversation today about some of the knee-jerk reactions, or some of the quick reactions. I shouldn't say knee-jerk, because that's a little negative or maybe condemning, but some of the really quick reactions that people are taking. And I think it's good advice because this is something that none of us have ever faced. I don't know if anybody, historically have faced such a situation where, we have two main threats to not just our economy and everything, or to our society, but really when I look at it personally, I have one threat. I have a health threat, right, to me and my family and my patients that I have to respond to, and I also have an economical threat. And so it's hard to, we just don't know. Like when you look at all these models, you can get overwhelmed with them all. I think the wisest thing to do is just, like I said, slow down. And that's when you get down to it, like we each have to decide, how do we lead our families? How do we lead our team, our business? How do we lead our patients? And my strategy really that I've come up with the last couple of days is, you know what, I'm going to take this a week at a time. And I'm not going to take any projections that, whether it's doomsday or whether it's super, super great, optimistic, positive, hey, we got a new vaccine or anything like that. I've tried to slow down and read slow news, as Cal Newport calls it. Slow news is news that actually has to be edited before it's published. And,
like a podcast.
Yeah. So that basically negates everything we're talking about. But yeah, it's just, we have to assess it day by day, and no more than week by week.
Yeah.
So I had to communicate that with my family and with my team at work, and they know that, they understand that the best could be, hey, May 1, we're back humming. Man, would that be awesome or what? I don't think that's going to happen personally, but or it could be August.
Yeah.
Or it could be a year from now that we're thinking, man. But
that's the unknown.
It is.
Yeah, that's the hardest part for people, I think.
Absolutely, it is.
I'm hoping, looking on the bright side of this, I'm hoping this is a little bit of a reset for everybody, just to slow down. I mean, just in general, and even if we come out the other side of it in a doing okay and whatnot, just trying to take the time right now to spend time with family and spend time with kids, and you've got worries going on in the back of your head, and that's been one of the toughest things. That is you like try to sit down. I told my wife last night, everybody went to sleep and I was trying to turn on one of the usual shows that I would watch on TV, and I couldn't watch it. I shut it off. I had to go find like a cartoon literally to watch, because I'm like, I can't watch this right now. It's not, my head's not in the right spot. So I think we just, you do your best. You try to get through it. And I think the idea of slowing down in the 1 week at a time, that did feel kind of good. About once we did say, hey, we're taking 2 weeks off. We'll try to figure this out. We're still trying to figure it out with our staff, but we know we can make that work for 2 weeks, and then we'll go from there. And, maybe I need to start hoarding some Lumify so I can keep drops in my eyes so I don't look like I'm freaking out all the time to my staff, but or my kids. But,
I think,
you just keep trucking.
I think in this, I'm actually, I'm pretty, in all of the doom and gloom, I'm actually pretty bullish. That's right. Bulls go up, right?
Mm-hmm.
Yep.
I'm bullish on the whole outcomes of the ability for us to adapt, as you've said. I mean, just by having conversations with Cheryl, within literally a week, we have gone from not having any services telehealth wise to now, like, I'm thinking of all these different ways I'm going to currently incorporate into our practice, and future ways to incorporate it into our practice once everything quote unquote normalizes. And so, like, I feel like all of you on the call, or all of you on the podcast tonight, I think I'm optimistic that will be the case. We'll get through all of this and we'll actually be stronger, just like anything. And so, Cheryl, I think you certainly have been the, what do they call it? The canary in the coal mine for a lot of this stuff. So I certainly, it was a week ago that we had a conversation that was about this long, and I just, I still just, it's like, it's just so weird. But very fortuitous that you were doing what you're doing, and you saw the writing on the wall, and it's been very helpful to me, and I think probably to Drew and and Kyle as well,
Mhm.
to have you out there doing what you're doing.
I appreciate that. Thank you.
Yeah, thanks. What are your
think-
last thoughts, Cheryl? Kyle, go ahead.
I was going to say that despite it all, as much as it is hard to see like the big picture, hard to see what could be around the corner. Just like I said in an email recently to you guys, to you all, to the group, is that we have to maintain the mindset of our mission and our calling and our responsibility. As eye care providers, we know that our type of practices are local, privately owned, or independent optometry, or optometry in general. That is the best mode of delivery for eye care to our communities, and I've kept that in mind as I've thought through this. Is just thinking, okay, it is my responsibility to do what I can to keep this ship afloat because my community needs it.
Yeah.
And
Mhm.
Absolutely.
having that kind of mindset of perseverance and we'll do what it takes, and that also forces you, like you were saying, Chris, to be really creative. I'm like you, I've been thinking through this telehealth, these new avenues for practice growth, and man, we could use it here, we could use it there, we could use it for dry eye follow-ups, we could use it for contact lens follow-ups, we could use it for, and we could really make our practices more efficient with this new modality. So I think there's a lot of opportunity on the other side. It's just a matter of making really wise decisions to get through it.
Yeah, and amen. You got to slow down and be deliberate.
Mm-hmm.
Yeah. All right, guys. Thanks for being on tonight. I really appreciate
Thank you,
it.
Chris.
Thanks, Chris.